In accident and emergency, the masks and visors may be new, the job of saving lives is just the same. And departments everywhere are open as usual, often specially divided into green and red zones to prevent the virus spreading. But patients simply aren't arriving in the usual numbers. In April last year, more than 2 million people attended one of England's A&E departments. Last month, fewer than 1 million sought help, the lowest figure since records began a decade ago, and a grave concern for the boss of NHS England.
There have been fewer of some of the conditions that would cause people to need to come to A&Es, but there have also, on the part of patients, sometimes been concerns about doing so. The message from the nurses, doctors, therapists across the health service is, if you are concerned about having a stroke, a heart attack, perhaps cancer, do come forward.
But unfortunately, people aren't just avoiding A&E. Far fewer are going to their GPs with symptoms that need to be checked out in case they've developed cancer. In March 2019, GPs urgently referred almost 200,000 people to hospital for suspected cancer in England. This March, the number of referrals has dropped to 181,000, prompting cancer charities to urge people not to hang back.
You shouldn't hesitate. You shouldn't think you're not a priority. It is absolutely critical. If you've got a lump or a bump or any other cancer symptoms, you come forward, get it checked out by your GP.
So hospitals are open for urgent and emergency care, and GPs are keen to speedily diagnose anyone who's become ill. But the health service's capacity to deal with those already on the waiting list for treatment has been damaged. In March 2019, England's hospitals did more than 300,000 scheduled operations. This March, only 208,000 operations went ahead as the NHS started to scale back to free up beds. Rob had been on the waiting list for a knee replacement for 6 months when he learned his surgery was postponed. He's had no word on when it might be rescheduled.
It really is painful to walk. So I literally think twice about leaving the house. I hope this is only a temporary thing and it's not going to be for months and months and months, because I do think it's time that we were looked and thought about, and the pain that we're having to suffer every day.
Rob is worried he now faces many months, even years of pain. And although the NHS has already embarked on a 6-week-long plan to return to something approaching normal, the backlog to get through is huge and growing by the day.